So the next task is going to be skill number 11, and that is putting a knee-high stocking, or some of you may know it referred to as a tad hose, on a client's leg. Now the first thing we want to do is make sure when we knock on the door, what? Great, that we use common practices. So we'll knock on the door. Hi, Mr. Client. I'm Hope, and I'm going to be your healthcare aide today. And guess what? We need to put some compression hose or some tad hose or some stockings on your leg per your doctor's orders. Will that be okay with you? Great. So, I'm going to go out and wash my hands, and I'll be back in a few moments. Now, your client knows that you're here in his home. He knows you're going to wash your hands because we have to do safety precautions. And now you've come back into his room. You have shut his door for privacy and possibly his blinds. And you now put on your gloves. So, some may ask, why do you need gloves to put on a tad hose or a stocking? You're touching somebody's bare foot, and you don't know what the situation is. So, to protect the client and to protect yourself, you're going to wear some precaution, which is your gloves. The other thing you're going to need for this task is your tad hose or your support stocking. So, I'm going to show you how the proper way of putting this on a foot, but I'm going to show you the steps that we're going to do prior to getting to this. Hi, Mr. Client, I'm back. Are you decent underneath your covers? Great. Because some clients may lay under bed with no clothes on, and some may not be protected in areas that they need to be. So what I suggest for testing purposes is to keep the client covered. You may take the sheet at the bottom of the bed and pull it up for your client. So the only thing that you're exposing is the client's feet, and that's where you're putting the tad hose on. So either way, you can pull the cover down to the bottom of the bed as long as the client is protected, but it's just as easy to do this. That way you're causing the client to have more privacy and to stay warm, because a lot of elderly clients get very cold. So now you're going to hold on, excuse me 1 minute. You're going to hold on to the client's foot. So you've got support, and you're going to take off their sock or whatever, and I don't want you doing this. That's a no-no. Why? We've repeated in other steps. You can tear the client's skin or cause abrasions. So you want to make sure when you're taking off the client's socks that you're doing it with care. So you're causing support, and you're rolling the sock off the client and then finish removing it. Okay? Now you have the bare foot. So you're going to take what is called a support stocking or a tad hose, and on the support stockings, all of them, there's a little square. And I don't know if you can see it, but I'm going to try to show you the best I can. There's a little square where the ankle is to go. It's a complete square. And you're going to make like a puppet. So you're going to take your hand in the tad hose to where that square is and make a puppet. Do you see what I'm doing? You're taking where the square is on the tad hose and you're making a puppet. Then you're going to pull the sock like this. Do you see? Does everybody see? That's how you're going to find where you're going to put the tad hose, the proper position. So we're going to try it again. Take your hand inside the tad hose and find that square. There's the square. And you're going to make sure you do right in the middle puppet. And you're going to make sure when you do it that it's the right side. So you don't want to put the sock on inside out. And then take your fingers and feel where the seam is across the top. So let me explain it again, because this is a really difficult task, believe it or not. These are very, very tight, and they're very, very difficult to get on a client's leg. And for testing purposes, this is something that you really need to be 100% accurate on, as is all your tasks, but this is one that's a little more difficult. You'll see a tad hose or your support stocking has a seam just like a regular sock. Do you see that? That's your seam. This is your square. So you want to remember when you're doing your tad hose that you make a puppet at the square. I don't mean to sound redundant, but I cannot stress to you enough just how difficult this task can really be, even for myself. Make a puppet right in the middle of that square and pull it all the way out. Do you see that? And then go to where the seam is. That seam where your fingers are need to go on the client's toes. Now it's a little difficult for me to do it on a mannequin, but I'm going to do my best so you get the object. So now I have the seam on the toes. Does everybody see that? You see that seam nicely across the toes? And you can practice this at home with a regular knee high. If you go to a store and get just a packet of knee highs, especially for you men that aren't used to putting on a stocking. It's not easy like you think as a sock, because a sock has so much play. These have a lot of, because they're a compression hose. So when putting them on a client's legs, what it does is help with the restriction of the blood vessels. So just a little bit of information. So now that you've got this on the foot, do not just leave your client like this. You're going to support it. And you're going to pull without causing the client. Now remember, I'm using a mannequin. You're going to make sure that you work this tad hose all the way down to the ankle. And of course, I'm making it look a little more difficult than it is. But this is what you don't want to do, especially for testing. You don't want to have this big bump on the foot and be trying to pull like this. That is a no pass. You have to have smooth. So if you see that you're putting the support hose on and you've got problems, go all the way back to the stocking. Put your hands all the way back in and pull it tight. Of course now, my poor mannequin has been abused. And pull that support hose tight. Do you see now how straight that support hose is? That's what you need to do for testing. It has to be completely straight. You can't keep pulling. What happens, once again, and we've spoke about this in other tasks, you will cause abrasions and tears on somebody's skin, especially the feet, because that skin is so loose, and if they're an elderly client, you know, that's a lot of years of skin that's been used. So you want to make sure that you always treat the client with the utmost respect. Now, you're going to get your hands back in there. I'm going to do this, which is a no-no for testing, but I'm doing it so you can see me perform this task. Get your hands in there and pull this hose. It's stuck in the mannequin's creases. And pull this hose tight. And remember that square that I showed you? That square will be completely on the bottom of the heel. Then you know you've completed this task correctly, because the square is sitting center on the heel. Then start where it's all loose. Put your hands in down here and pull this tad hose tight. All the way up over the knee. Do you see that? Has to be up over the knee. Smooth, no wrinkles. Now, after you've completed that and it's smooth up over the knee, make sure that you loosen up around the toes because you don't want their toes to be all scrunched in there. That is the proper way to put on a tad hose. The ankle is in the heel is in the square. It's completely without any wrinkles, and it's up over the knee. Then what you'll do, you can ask the client, do you want your sock back on, which many of them do. Hold the client's ankle with support, and then cover your client back up. And make sure if you're redoing the bed that it's not tight, that the client has room to move their feet. This now is completing of this. You'll take off your gloves. You'll throw these in the trash, and you'll ask Mr. Client or Mrs. Client, how are you doing? Are you doing okay? I'm sorry, I struggled. Boy, that was really tight today. And the other thing I didn't mention, and my apologies, the entire time we're putting on the tad hose, we're constantly assuring and asking the client, is this hurting you? Are you doing okay? You're not going to be struggling as much as I did with a mannequin because you have a little more flexibility with a human foot. But you're still going to ask them because what? That's part of our common care practices. Is there anything I can get you, Mr. Client, before I leave? Sure, no problem. He would like his remote control so he can finish watching TV. That there ends our task.